Welcome back. A health psychology expert at Hartford HealthCare is leading a powerful shift in how mental health support is delivered. At the heart of her work is the Prism program, a unique initiative designed to help people better understand and manage the connection between their physical and emotional health. Joining us today is Dr. Sanel Wartel, Doctor of Health Psychology at Hartford HealthCare. Doctor, thanks for your time this morning.
Good morning. Thank you for having me.
Of course, very interested in what you do. So can we start by asking you to explain your role and what exactly you do?
Absolutely. Most people haven't heard about what a health psychologist is.
Right.
A health psychologist is a unique role where we are, as mental health providers, embedded in the medical setting. So I came to Hartford HealthCare 5 years ago to start a behavioral health, mental health, social health program within gynecology. And I get to address those social and emotional factors within the gynecological healthcare, along with the providers helping the patients.
And is this the Prism program that we're talking about?
Yes, PRISM standing for pelvic, reproductive, intimacy, sexual health, mental health. That's the acronym I came up with to help us think about all the different issues that might come up for these patients.
Very interesting. And so there's a lot, obviously, that you cover. So I guess what does a typical therapy session look like?
Yes, I have women from all of different areas of gynecology coming to me to address pelvic pain or issues where they're really having maybe an anxious or phobic reaction to having to get a pelvic exam, for example. And these are women coming to me, and we may be in the medical setting, in an exam room, in real time, holding different tools that you might use during the exam to help them get more comfortable with that space, to decrease that anxiety, or to help address the pain that they may be having in a sexual relationship. The therapy may be individual therapy.
Right.
So I see people on a bi-weekly or every 3-week basis, short term, 6 to 12 sessions to really address one specific issue, or group therapy. And in the groups, I run a pelvic pain group as well as a sexual health group. These are virtual and they are 12 weeks. And really the goal there is to help women come together to be able to discuss issues that are true for them that we don't get to discuss usually, right? That there's a lot of stigma or shame around these sexual health or pelvic health or body image concerns.
Well, that's exactly what I was going to point out. You know, the work that you do, I'm happy that we're having this conversation here on live television because maybe we are talking to someone who is watching this interview at home because let's be honest, it is a bit of an uncomfortable conversation. So maybe a woman is afraid to bring it up to her healthcare provider or even doesn't want to admit it to herself. So it's good that we are having this conversation and to let people know not to be afraid and that there is help if you are going through this.
I couldn't agree more, Alyssa. I think this is something that even providers are uncomfortable with at times, and we're working to help this become a more comfortable, common conversation, helping patients advocate for themselves and really know that you're not alone. 95% of women have trouble with their body image.
Absolutely.
Half of women post-menopause describe that low desire, right? These are common issues.
And you have an upcoming community webinar taking place this week, and I'm sure a lot of this will be talked about. Can you tell us more about that and how people can join you?
Absolutely. So Thursday night this week, hopefully, if you're sitting on your couch or you want your partner to join, you can learn about low sexual desire for females. I'm going to be talking for an hour about all the different reasons this might come up for someone. As I said, it's common. Half of women post-menopause or during menopause, and a quarter of those pre-menopause are struggling with these issues. And so it's helping us think about tips or tricks, how partners can better support their female partners and have a better life and feel better about themselves.
Oh, that is wonderful. Thank you so much for your time, and we will have that info on our website as well, WTNH.com.
Thank you so much. Have a great day.
You too, and we will be right back.